Hello, everybody. We're going to talk about the digestive system infections, where in this system you can find the most and diverse normal microbiota in our body. The main functions of the digestive system are to take in food, then broken down the food into nutrient molecules so the body can absorb it and finally get rid of the ingestible remains through feces. The digestive system organs are divided into groups. The alimentary canal, the gut, it's like a tube that runs from the mouth to the anus. It is made up of the mouth, the pharynx, the esophagus, the stomach, the small intestine, the large intestine, and the anus. The accessory digestive organs are the teeth, the tongue, the gallbladder, the digestive glands, and this one, the digestive glands, are the salivary glands, the liver, and the pancreas. The pathogens that we are going to focus that cause infections in the digestive system are um, the bacteria Salmonella, that is a gram-negative, meaning that it has a thin layer of peptidoglycan, and it is rod shaped. It is facultative, meaning that it can live with oxygen or without it. Uh, E. coli, it is also gram-negative. It is rod shaped, and it is anaerobic. In some strains are facultative too, and normally lives within the intestines. The rotavirus, it is from this family here, and it is a double-stranded RNA genome. For the parasites, which is Giardia, which is the most common intestinal parasite. This parasite, it is microscopic and it lives in the intestines. For the fungi, which is the Basidiobulus, this one can cause um, a rare fungal infection, and it is a filamentous fungi. And continue on, my partners are going to talk more about it in more detail.
How these pathogens enter the body system. Both E. coli and Salmonella enter the body system through the fecal-oral route when we ingest the bacteria. Both have a vehicle transmission, meaning that both pathogens transmit through vehicles like water and food. They come from exogenous sources, which are outside of our organism, like from the environment. Therefore, E. coli is a communicable disease which spreads person to person. For example, for not washing your hands properly, and the handling of contaminated food like undercooked beef, soft cheeses from raw milk, and contaminated beverages like water. Then we have salmonella. When salmonella is ingested, it passes through a person's stomach where it colonizes the small and large intestines. It is contaminated food with feces from infected animals. That's where salmonella is located. Um, it is a zoonotic disease because it spreads with direct contact with animals like reptiles, turtles, iguanas, etc. Therefore, it is rarely transmitted person to person. Then we have the rotavirus. which enters the fecal oral route, where it then infects the lining of the intestines. It has a direct and indirect contact of transmission. Large amounts of rotavirus are in the stool of infected people and can be easily spread through contaminated hands and objects, for example, toys. Then we have Giardia, which is transmitted from person to person, like hands contaminated with fecal matter, from example, parents changing diapers, they can get Giardia. Then we can also get it into our bodies if we swallow contaminated water, for example, water from lakes, ponds, rivers, etc., and from contaminated food. It is also spread through anal intercourse. And here we have a picture of Giardia. Then we have Bacillobulbus rhinarium, which is a fungi. Here we have an image. It enters the body through the ingestion of infected foods, also by using contaminated papers to clean the skin. It can also be a topical pathogen. It infects the gastrointestinal tract and usually infects immunocompetent individuals. That's why it can be classified as a true pathogen.
How these pathogens affect the digestive system. Today we're going to focus on five main pathogens. We have two bacteria, the Salmonella and E. coli, one virus, rotavirus, um, Giardia that is a parasite, and one fungi that is Bacillus voluminosus. So let's start. Salmonella. This bacteria we can find mainly on the intestines. This affect the intestines. The transmission can be by eating raw food that is contaminated with animal feces. Also by eating unwashed fruits, and eating beef, eggs, poultry, and milk. The symptoms are diarrhea, fever, and stomach cramps. These symptoms appear between 12 and 72 hours after there's an infection. The second one, we have E. coli. It is a harmless bacteria that lives in the intestines. This bacteria is recognized by the CDC, as a foodborne illness. Also, it can be transmitted by eating uncooked food and contaminated ground beef. Also, another way to be contaminated with this bacteria is by getting contact with a person, swimming, or drinking contaminated water. So next, we have the rotavirus. This one can be found on persons, places, or things. So, when you have contact with infected person, places like bedrooms, public restrooms, and things like toys, tables. Um, this rotavirus affect mainly the digestive system. It can be transmitted by orally, by accidentally swallowing the virus, like when you grab um, something like a pen, and then you eat your nails or you touch your face or your mouth. You can be swallowing this virus. So next we have the Giardia that is found on the contaminated um, food with animal feces. This also can be transmitted with, well, this can be transmitted by orally eating food, raw food. Uh, their symptoms are nausea, bloating, and abdominal pain. The last one, we have the Basidiobulomycosis. This is kind of hard to say. So this is a fungal infection that affects the digestive system but also affects the intercommunicatory system. It can be transmitted by infected food and using infected paper to, that can be used to clean the skin like toilet paper. And the symptoms are abdominal pain, fever, and skin troubles. And that's it for today.
The pathogen Bacillus is a less commonly acquired pathogen than E. coli, Salmonella, rotavirus, and Giardia, but all these pathogens are common around the world, but more common in developing countries. These pathogens are more commonly found around the world because of the lack of resources in many countries. Drinking and bathing in contaminated waters, as well as eating and poorly cooked foods containing these pathogens, lead to a higher percentage of contamination. Traveling to countries with poor sanitation may spread the pathogen further on to others in well-developed countries as well.
Drugs and treatments. E. coli does not require antibiotic treatment. Antibiotics are not advised because they may increase the risk of HUS. People should get plenty of rest and drink a lot of water to prevent dehydration. If the patient has diarrhea, medications are not recommended because those medications can slow down the digestive system. In addition, healthy adults recover in a week. Then we have salmonella. Healthy adults with diarrhea is recommended for them to drink water and fluids. There's a rehydration liquid called Pedialyte, and there's also medication called loperamide, which is only recommended if diarrhea is severe. For children with a healthy immune system, the doctor might just let the infection run its course, but the child needs to drink a lot of water. In case they have high fever, they should take a medication called acetaminophen. Therefore, infants, elderly, and people with a weak immune system, those are the ones required to get antibiotics. Rotavirus, for children, it is recommended for them to replace body fluids by drinking liquids, which are called oral rehydration solutions. Those contain water, sugars, and salt. In adults, the infection is usually asymptomatic, but it may cause diarrheal illness. There are two medications for rotavirus. The first one is called Rotatec, which is given in a 3-dose series with doses at starting with ages 6 to 12 weeks of age. And there's also a second dose, which will be administered at 4 to 10-week intervals. And the third one should not be given after 32 weeks of age. The second one is the Rotarix, which is a 2-dose series for infants from 6 to 24 weeks of age. Then we have Giardia, which has 3 medications. The first one is called metronidazole, which is the most common. A fact about this medication is that people should not be drinking alcohol while taking it. The second one is called tinidazole, which can be given in a single dose. Then we have nitazoxanide, which is in a liquid form. That's why children prefer to drink this one because it's it's easier to swallow. Finally, we have Bacillobullis rhinarum, which is a combination of surgery and antifungal treatment, which has a period of time between 6 months to 2 years. And the most common drug use is called itraconazole.
E. coli was discovered in 1885 by Theodore Escherich. This bacteria is known to be able to grow with or without oxygen. E. coli can be used to make useful substances, for instance, human insulin and human growth factor. Salmonella was discovered in 1885 by Dr. Daniel E. Salmon. Of all the Salmonella outbreaks that occurred from 1985 to 1999, 62% of infections were associated with food prepared at commercial food establishments. Infections of Salmonella are more common in the summer because it grows quickly in higher temperatures. Giardia was discovered in 1681 by Anthony van Leeuwenhoek. Giardia symptoms may persist for around 2 months if left untreated. A small amount of people can develop long-term giardiasis, which can last up to 2 years. Bacilloballus was discovered in 1964 after a presumed case was reported of a 6-year-old boy. Since then, well-documented cases have been reported worldwide. Rotavirus was discovered in 1973 by Ruth Bishop and her colleagues. Unvaccinated children are more likely to be infected after the age of 3 and are at greatest risk of developing severe diseases from rotavirus infections. Vaccines for rotavirus have been available since 2006.